Welcome to the Costa Rica, Your Partner in Healthcare and Destination Abroad webinar. Before we begin, here are some housekeeping items. Please utilize the Q&A function on the bottom of your screen to submit questions to the speakers and panelists if time permits. If you have any technical questions, please dial 916-444-2221. Again, the phone number is 916-444-2221. Please welcome to the webinar stage the California Hispanic Chambers of Commerce President and CEO, Julian Canetti.
Good morning and welcome, everyone. The California Hispanic Chambers of Commerce is excited to have you online this morning for an exciting webinar in partnership with the government of Costa Rica, the Costa Rica Export Promotion Agency, and the Costa Rica Health Chamber. But before I introduce them, I would be remiss if I did not thank past CHEC Chairman Manny Rosales, who has been very instrumental in coordinating this webinar with the CHEC and the Costa Rica government. Costa Rica has built a reputation as the happiest and most eco-friendly country on earth for its achievements in sustainability and environmental conservation. Each year, Costa Rica receives thousands of patients from around the world seeking affordable procedures and treatments in areas such as orthopedic, bariatric, dermatology, ophthalmology, oncology, dental, and more. We hope that you will share the resources and opportunities to your chamber leadership, employers, employees, and community stakeholders. Now, it is my pleasure to introduce Costa Rica Foreign Trade Promotion Authority Executive Zacarias Ayub.
Very good afternoon, everyone. It is my pleasure for being a part of this initiative from the Costa Rican government. I do represent the Export Promotion Agency of Commerce here in the U.S., and we're delighted to promote this sector with all their benefits. Factors that motivate U.S. patients to travel abroad for medical care: the high cost of healthcare services in the U.S., the increasing number of people with no insurance, not availability of certain procedures at home, the possibility also to have a vacation in Costa Rica are some of the factors that when people decide to have a treatment, that's part of the main goal when they go into Costa Rica destination. What type of medical procedures could you find in Costa Rica? We go from cosmetic surgery, from dental treatment, orthopedics, and cardiology. So I would like to welcome, as the Export Promotion Agency promoter, to visit Costa Rica. I'm very aware that Costa Rica is a very well-known destination in your agenda. So we welcome you with open arms to be a part of this initiative, to come with all the trust into Costa Rica with their medical facility, with the certification and the facility that we can provide. So it is a pleasure, again, to be part of this webinar. And again, be welcome to Costa Rica whenever you wish to come, and we'll be more than happy to host you. Thank you very much.
Ladies and gentlemen, please welcome the Ambassador of Costa Rica to the United States, the Honorable Dr. Fernando Yorka.
Hello, everyone. It's a pleasure to be today here with you, at least online. But I want to thank the Hispanic Chamber of Commerce, the Hispanic Chamber of Commerce of this great state of California for the opportunity. I want to also thank my dear friend Manuel Rosales for making this webinar possible. Actually, we miss you here in Washington, D.C. And of course, it's a pleasure to share the panel with Zacarias Ayub, Brad Cook, Massimo Mansi, and Rashesh Rao. I want to tell you a little bit about the Costa Rican healthcare system we are proud of. And I'm not going to speak only as a former Minister of Health, but at the same time, as a medical practitioner that has been able to practice in 3 different countries, in Costa Rica, Spain, and the UK. And Costa Rican healthcare system is something we really like to share as an opportunity for the rest of the world to from Costa Rica. Please, the next. We are celebrating 200 years of independence life, and we are proud of that. But we are still a small country with a population of 5 million people, and we've been developing as one of our main activities the tourism, and we are lucky to say that we used to, before pandemic, to receive 3.5 million tourists each year, most of them coming from the United States, at least 2 million tourists per year. We haven't recovered all of these numbers before the pandemic, but we are on the way to do it, and we have recovered so far most of it. That shows you that people from the United States are used to visit Costa Rica. They know Costa Rica. They know we are a friendly country. And at the same time, that shows that we have a lot of flight connections, and there's a lot of people traveling actually to Costa Rica. In Costa Rica, we have we usually invest in human talent. Education is free and mandatory for all children since 1870, for example. That produced an adult literacy rate of 97.9%. We are also a strong democracy since 1889. That shows more than 133 years of enjoying democracy as a national, a very important value we all recognize. We also have a public healthcare system established since 1941, and we recognize that international multilateralism organisms like the World Health Organization and PAHO, they see the Costa Rican healthcare system as one with universal coverage since the 80s. So we are proud of sharing this reality that we are able to reach every corner of our country, providing healthcare to the population. That give us a life expectancy of for all of more than 80 years already, an infant mortality rate of 7.5 per 1,000 births nowadays. And it's good to mention that we also abolished the army in 1948. And we've been able since then to invest most of our GDP in education and in health care. Our energy, 90% of our energy is coming from renewable sources. Most of them hydropower in 72% of the cases, wind power 12%, and geothermal also, because we are lucky to have a lot of volcanoes, and we take some advantage from it. 15% of our energy is coming from that. Biomass and solar are also growing, but you know, Costa Rica, it's a friendly environmental country, and we protect 28% of our land and 30% already of our territorial waters as a national park or as a protected special areas. Almost 60% of our country's total area is covered by forests. This is a successful story because we were able to stop deforestation and we recover the forest in a high percentage, as you can see. Please, the next one. But we are a country facing a lot of demographic challenges because our population is becoming an old one, and we now know that in 2035 our population will be a very old one, and you know, a specialist in health and in healthcare knows that we should prepare for that, and actually we've been doing that, and we believe we are ready to face that demographic change in Costa Rica as a real thing. But at the same time, you know that epidemiological problems, our healthcare and our professional health and healthcare professionals are usually deal with are the common problems developed countries already got, like cardiovascular diseases, cancer in a very important percentage, chronic respiratory problems, diabetes, and of course we know we have these developed country epidemiological problems to deal with. Please, the next one. That's why we've been investing constantly a lot in education, but at the same time in health. At least 6.7% of our GDP, according to the World Bank, has been, we expend that on education, and in health is 7.8 and usually 8%. At least in the 5 years, according to our system of health account report published in 2016. But Costa Rica is also one of the 2 countries recognized in Costa Rica, in Latin America, that at least able at least to invest 6% of our GDP in our public healthcare. Please, the next one. And here is a chart that shows that this expenditure has been constant across the years. In the blue color, we are able to show that public institutions, of course, are the ones who usually invest the highest amount of money, but in the gray and in the yellow, you can tell how the private sector has been also investing a lot and growing all across the years. Please, the next one. That's why our healthcare system has been recognized all across the world, and in some ranks, it's very well ranked. For example, the Bloomberg Index 2018 recognized our healthcare as the 33rd world's healthiest nation of the world. Costa Rica is also 25th economy with the most efficient healthcare according to the Bloomberg Health Efficiency Index 2018. And it is the 3rd best healthcare in the world according to the annual Global Retirement Index 2020, and ranked 36th place in health performance by the Legatum Prosperity Index in 2019. Please, the next. So we were able to develop this public healthcare system model that actually is able to cover the whole country, coming from the local level with a strong presence on what we call the first healthcare units we have is like small medical centers accessible and available for all the population that live in the local area, and very well connected with regional hospitals, province hospitals, and at the same time the national level very specialized hospitals. Please, the next. And at the same time, it's good to recognize that in this system, not only nationals got access in case of an emergency, even foreign people are going to be able to access this this public healthcare network all across the country. Please, the next one. And that shows you that we have actually a lot of local medical centers available for all our population, and at the same time, in case of emergency and some specific situations for foreign people. Please, the next one. But we also develop a strong private healthcare system. It's impossible to have a national healthcare system without a strong private and public sector, and we are able to offer to the foreigners and the nationals, of course, 10 hospitals, private hospitals in Chochal, and with a strong presence in all the provinces of the country. And we recognize, of course, that most of the specialized services are basically located in the capital, but we are able to coordinate and articulate with the rest of the country private sector to have access to those specialists if needed. Please, the next one. So that's why Costa Rica has been working in what we call medical tourism, and it has been growing. Most of the people are usually coming from the US, Canada, some Central American, some other Latin American countries. They reach the country to have access to medical services. Costa Rica is now receiving at least 70,000 patients per year, and we recognize that most of them are coming for dental specific treatments, 38,000 per year at least. And definitely one of the main reasons is because we are able to offer and to keep high quality services, but at the same time in a very low cost. At least the cost of our country are between 50 and 70% less than the US, keeping the same quality. Please, the next. And that's possible because we've been investing a lot in human talent, not only in the public sector, but also in the private sector. We produce most of our health professionals, and we are lucky to have 8 medicine schools, 9 nurse schools, 7 pharmacy, and so on. We are able to cover most of the specialists, but we have a lot of professionals also train abroad, and most of them train in the US best hospitals and universities, and that shows, please, the next one, that we are now developing a lot of public and private partnerships between the public sector and private sector, mainly private universities, high quality ones, trying to to guarantee all the specialists and all the health professionals our health sector will need, not only to cover our own population, but at the same time able to cover the needs of all the foreigners that wants to be treated in our country. Please, the next one. And at the same time, we are also developing strong policies that guarantee that human rights and some other related are going to be respected as something very important in a country like Costa Rica. We are now promoting the country as a place to live for retired people from other countries. There are specific acts and regulation about it. And the only thing they need to show is that they are earning or receiving as a pension from abroad basic amount of $1,000 per month, and they will receive specific benefits from it. But at the same time, in Costa Rica, we've been able to develop a specific acts and strategies and policies trying to avoid discrimination and stigmatization of our patients due to age, religious beliefs, race, diversity in general. Mental health problems is something that we've been working a lot recently. And of course, cultural traditions. Our healthcare professionals are very well trained to be able to deal properly with all of these different patients they may receive. Please, the next one. Costa Rica is trying to become a bilingual society. Definitely, we are first in Latin America in some international well-recognized tests like TOEFL, for example. But in Costa Rica, you may find always someone that speaks at least one of 13 languages. Which languages? Well, the most common languages that of course English, but at the same time French, German, even Chinese, the Mandarin, of course. But Costa Rica government developed a specific strategy since 2018 to truly become a bilingual country in the few years. Please, the next one. And well, it wasn't. It's impossible for me to mention something about the healthcare in Costa Rica without saying that Costa Rica has been able to successfully vaccinate most of our population so far. And we only use best brands, the ones that has been accepted and registered here in the United States or in Europe, for example. And now we covered 72% of our population with the complete vaccinated with 2 shots already, and 93% of our population among 12 years old has been received at least 1 shot, which is a lot and a very successful vaccination strategy we were able to develop already in Costa Rica. Please, the next one. And well, as a final comment, I would like to add that Costa Rica is ready to help patients from the United States and some other places around the world. We are happy to receive them, and of course, what we want to share is the great healthcare system we've been offering our population since decades ago. Thank you so much.
And now a message from Medical Tours Costa Rica.
Medical Tours Costa Rica. is the leading medical travel concierge and facilitation company, assisting international patients in Costa Rica since 2006. Our warm and experienced staff provides coordination of care and hospitality services that meet the demanding needs and expectations of patients coming through U.S. employer-sponsored healthcare plans, as well as directly. Our goal is to not only support and pamper the patient through timely and personalized assistance, but to anticipate and eliminate any possible barriers so the patient can focus fully on their recovery. Each step of the patient experience has been carefully designed with your patients and their companions' needs in mind. Starting with pickup at the airport, the patient and companion will be welcomed and assisted by a bilingual patient coordinator, prior to being transferred to a beautiful hotel with daily nursing visits overseen by the patient's physician. Once at the hospital, the patient will be assisted and escorted by our bilingual staff to each appointment, ensuring a smooth experience pre, during, and post-treatment. For the patient's protection, COVID protocols as per Costa Rica's Ministry of Health requirements have been implemented to mitigate infection risks throughout the entire continuum of care while in Costa Rica. Let Medical Tours Costa Rica focus on all the details so your patient can focus on their health and recovery.
Please welcome to the webinar stage the President of Medical Tours Costa Rica, Brad Cook.
Yes, hello. Why Costa Rica provides an ideal destination for medical treatment and recovery. At Medical Tours Costa Rica, it's our job to handle all the logistics on the ground and make sure the patient experience is seamless. Medical Tours Costa Rica is a leading medical tourism facilitation company in Costa Rica, having provided and managed offshore healthcare services for more than 3,500 patients, mainly from self-funded companies in the United States, and in coordination with our partner Indus Health that will be speaking shortly. By partnering with world-class Joint Commission accredited hospitals, we can assure patient safety and quality healthcare to all our patients. So Joint Commission accreditation is considered a global standard in healthcare. The Joint Commission that accredits our hospital in Costa Rica is the same organization that accredits US hospitals and seeks to continuously improve collaboration with other stakeholders by evaluating healthcare organizations and helping them excel in providing safe and effective care of the highest quality and value. And it's important to note that Joint Commission every 3 years brings surveyors back to continue to review and assure that the hospitals are striving for the highest quality. It's not a one-time standard. We are a one-stop shop and concierge center at Medical Tours Costa Rica. So it's important to explain that the patients, when they come for medical travel, they're probably at the hospital 1 or 2 days, but it's the whole experience around that, from everything that they're doing to prepare for their experience, to the travel, to the pickup at the airport, to their time at the hotel. So I want to talk a little bit about that. We have partnered with some of the leading bilingual specialists in Costa Rica who offer top quality, affordable healthcare. And our team of experienced industry professionals will connect the dots, interfacing with each certified provider, ensuring the entire medical travel process is seamless. So I want to get in a little bit to the nuts and bolts, what it looks like for the patient when they're on the ground. So first of all, we have a team of patient coordinators, and they're kind of like your best friend. They will be assigned to your care. This will be the post pre-op appointment. Uh, as well as the doctor. Just one. One second here. Hand holding, they're on site, they're helping you with every little detail. They're coordinating nursing. For example, when the patient is at the hotel, a nurse will come every day. The doctor needs to know, they'll be letting them know and assisting. Also physical therapy, especially for orthopedic procedures, that will be done at the hotel as well, generally started at the hospital, and then the physical therapist will travel to the hotel. Everything is designed for the patient's comfort and for a stress-free process. We work with several hotel properties. We've tried to pick hotels that patients will love, that they'll be able to recover. The staff at the hotels have been trained, educated on the special needs of a medical tourist. So we have a lot of things in place there. There's generally a champion at the hotel. So if there's anything we want to communicate with the hotel, the patient's uncomfortable with something, we'll let them know, or we'll send one of our patient coordinators over to the hotel as well. Some of our patients, if the doctor approves, go on tours. We generally have half-day tours right now where they might go to a coffee tour or to a volcano. Some of those can be done in wheelchair, and it just depends on the patient and companion. Another thing that's really important to mention is the medical records. All those will be translated. The patient will be able to take those home when they leave. They'll have notes on what they're supposed to do for physical therapy, diet, medication, and all that will be taken with them so they can communicate with their physician back home, and they'll know how to continue the process there. And also our team and our doctors are also available to speak to them once they're back. To talk a little bit about some of the procedures. We do a lot of different things, but these are procedures that need to be non-emergency, that the patient can come. They can be done in a week to 2 weeks at the very most. On average, patients are probably here 7, 8 days, depending on the procedure, but from orthopedics to neurosurgery, general surgery. In orthopedics, we do a lot of arthroscopies, joint replacements, knees and hips. In neurosurgery, spinal fusions, laminectomies, disc replacements, hernia repair, and general surgery. One of the procedures we do very often are gastric bypass and gastric sleeve. We have quite a few patients coming from companies for those procedures, as well as gynecological procedures, ear, nose, and throat procedures. As the ambassador, I believe, mentioned, dental care. Costa Rica has some unbelievable dental facilities. And so these are just some of the procedures that we're doing continuously through our medical team. And we work with quite a few surgeons, but I want to introduce a few of them so you have an idea, what a doctor down here might be like that would be assisting one of your patients. First of all, Dr. Oscar Oeding, he's an orthopedic specialist, has been working with us for over 10 years. He's also been the physician for the national soccer team in Costa Rica. So he's very, very experienced with sports injuries, and he's operated on hundreds of our medical tourism patients, and patients love him. Dr. Jacob Sofrani, general minimally invasive metabolic surgery. He's done over 4,500 procedures. He's founder and director of the first training center for minimally invasive surgery in Central and South America. He was also born in the US while his father was studying medicine as well, doing his internship in Indianapolis. So patients love him for some reason. I don't know why, but they do. But we joke around a lot. He's a great doctor. Dr. Adrian Cáceres, our neurosurgery doctor, he's Harvard trained, did his residency at Northwestern in Chicago. Unbelievable doctor. And so he's another example of the doctors that we have working on our patients and medical tourism. I wanted to add Dr. Sofrani, when Costa Rica's president had an emergency surgery a few years ago, he was the doctor called in. So that's the sort of doctor operating. Dr. Carlos Escalante does what he likes to call the women's surgery. He's published in over 10 international scientific papers, studied in Europe, Costa Rica, Asia. So he's also a doctor that our patients have had outstanding experiences with. So those are some examples. Obviously, these doctors work with internal medicine doctors. They work with an entire team. Patients will be evaluated prior to surgery to make sure that they can go in and have the procedure, and also post-surgery. Costa Rica, well, it's I guess the ambassador mentioned it, but most people know about Costa Rica. They've heard about it when I travel to the US. If I mention I live in Costa Rica, they'll say, oh, I've been there, or a friend of mine has been there, or I'm planning on going, or I just loved it. So maybe just we'll highlight a few things that make Costa Rica such a great place. I'm actually a dual citizen, so a US citizen and a Costa Rica citizen. But first of all, proximity. It's easy to get to Costa Rica. It's 2.5 hours from Miami, 4 hours from Houston, from Dallas, 5 hours from New York, 6 hours from Los Angeles. So there's a lot of there are quite a few direct flights. So it's easy to get to. And when the patient arrives, they'll get off the plane and there'll be somebody there meeting them and helping them through customs. And also when it comes to Costa Rica culture, it's a rich and vibrant country. And there's a word that kind of describes who we are in Costa Rica, and it's called Pura Vida, which means pure life. And it's kind of hard to explain. Here, there's kind of talks about everything, but it's living simply and intentionally, appreciating nature, cherishing loved ones, taking care of your mind, body, and soul. All ideas that promote happiness within, and I think that's kind of the Costa Rica way. Foreigners are always not necessarily surprised, but they always comment on how well they're treated, how well they're liked, how much at home they feel, and that's why we have so many expats, especially from the United States, but also coming from other countries that have decided to make Costa Rica their home. Costa Rica also has unbelievable nature. Over 25% of the country, I think almost 28%, is protected by national parks and reserves. So it's just a beautiful country, from lush rainforests to volcanoes to hot water springs to beautiful beaches. And yeah, patients unfortunately can't see all of that, but we do try to help them see a little bit with the tours that we do. But it just makes for an amazing place to recover. When it comes to food, one of the things patients are always commenting is how they love the food, how healthy, how natural, how they want to eat differently when they go back home. And I think that's part of the whole holistic process in getting better. First of all, Costa Rican coffee is some of the best in the world. And, our fresh fruit, from mango to papaya, watermelon, pineapple. So I'm looking at this slide. The breads, there's something here that's amazing that's called gallo pinto, which is a mix of rice and beans that's eaten for breakfast, along with all these other things with sour cream. And patients come to love it as well while they're staying at the hotels and recovering. And as far as safety, Costa Rica is consistently rated as the safest country in all of Central America and the Caribbean. The Army was abolished in 1948, 1949. There's been no standing army, and all that money has been used in healthcare and education and environmental preservation. So it's really an incredible country. And I honestly have to say, I generally feel much more unsafe when I'm in the US and going through big cities and trying to figure out, where to go and where not to go. And I think that's kind of the same in any country. There's areas that are safer than others, but we've never had any issues with any patient ever. And we've had hundreds, and our patients are always with a driver, with our team. When they go on the tours, the folks that do our transfers also do our tours. So they're always handheld through everything, and safe. At Medical Tours Costa Rica, it's all about creating an extraordinary medical experience at an affordable price. As Tim Eisenhower, the benefits manager for HSM Solutions in North Carolina, who has sent over 400 employees for surgery to Costa Rica, once said, something magical happens in Costa Rica. And he must know because he's had 2 surgeries here. And his wife has also had a surgery here. So I think he knows what he's talking about. And I'll be happy to take questions at the end. And I'm going to let Rajesh continue and explain a little bit more about our program here in Costa Rica.
Ladies and gentlemen, and now a message from Kyle Wendt, the Director of Global Benefits from CommScope.
Okay, we're now joined by Kyle Wendt. He is the Senior Manager for US and Canada Benefits for CommScope, one of the clients that has been using medical travel. And Kyle, thanks for joining our webinar today. Can you tell folks a little bit about how this travel option, this medical travel option, has helped your employees?
Sure, happy to, Chad. This was an option that we added to our medical plan a couple of years ago, and it's been an easy add for us. We think it's a win-win to encourage employees to get specialized care, particularly joint, hips, things like that, and allows them to consider a different venue than perhaps they would here in the US. And so it's provided a real nice option for us to allow employees to take advantage of that.
What kind of satisfaction levels have you seen from the employees that have taken advantage of this program?
Yeah, the employees that go to Costa Rica for the surgeries, they rave about it when they come back. They truly do. They're happy to talk with other employees about it. And I would say this is a true word of mouth benefit. So when someone first hears about going to Costa Rica, they're not quite so sure. And when they talk to a coworker who did it, they see that it's okay. So I would tell you they're very satisfied with the service they've received.
Obviously, you were very instrumental in plugging this into the benefits package for CommScope using Indus Health. How would you describe the relationship with Indus Health and how it's been working with you delivering all of this?
Yeah, I would say the relationship we've had with Indus Health, implementing the program and then continuing to run it, has been seamless. And so they've been great to work with. Implementation was really very easy. They did all the heavy lifting. You just on the back end have to make sure you have provisions to pay claims, things like that, which we work that out. And but they take care of all the intake for our patients. They do all the approval process. Then on the back end, they let us know that the person's been successful and had the surgery. So I found Indus Health to be very easy to work with.
Anything you'd like to add with respect to having implemented this? I mean, some other companies probably think you're a little nuts sometimes, but obviously it's worked very, very well. So anything you'd like to say?
No, it's worked very well for us. And you're right. Sometimes you get the reaction, what do you mean you're doing centers of excellence outside of the US instead of the US? And I can tell you anecdotally, we've tried centers of excellence in the US and really did not have a lot of success. And so whether folks like traveling to Costa Rica, they like the cachet of that, I don't know, but they like the service that they get. They like the cost of the claims and their out-of-pocket costs, things like that. And so they feel like they're getting superior service. So I think at the end of the day, that's probably what I would add. It's been a great success for us, and we do plan to continue the program.
Well, Kyle, I appreciate your time. Thanks for joining us today.
Ladies and gentlemen, please welcome to the webinar stage the CEO of Indus Health, Rajesh Rao.
Hello, everyone. So I'd like to give my remarks on why people choose Costa Rica. I mean, it's all about the people and the level of care that they receive. Being able to provide not only an outstanding level of service in terms of the actual surgeries, and the doctors, nurses, everyone is obviously top of their game, but also the glue that fits, in terms of fits it together in terms of providing the coordination, providing the hand-holding. It's the people that make the difference. There's a level of care that's offered to our patients that makes them feel like they're with family, and it really helps extend the warmth and hospitality. And most of our patients go there not knowing what to expect. Some of them don't even know where Costa Rica is when they make the selection, and it's an eye-opening experience for them. And to have somebody that really cares for them and offers them extra special treatment makes a difference that they come and rave about. So with that, I'd like to continue. I'm going to condense my comments. I'm not going to read through the slides. I'm going to just condense things, and these are going to be provided for your reference, so you can always go back and refer to the detail in the slides later. Next slide, please. So what causes employers in the US to embrace this notion? One is clearly higher medical costs and lack of competition, causing a lot of expense, not only to the employers, but also out-of-pocket costs to employees that are unaffordable. So majority of the patients we serve fall into the category of being underinsured. They don't have enough money to pay their out-of-pocket costs. So in many cases, the surgery locally becomes a non-starter. And we address that by providing this service where they can essentially get it with all expenses paid by the employer, mainly because the costs are so much lower. The other factors are, as Brad pointed out, the Joint Commission hospitals being available to the extent they are now and accessible outside the country. It makes a difference that there's more trust and capability that's extended in medical sciences elsewhere. There's also a higher confidence just by having run our program as long as we have. We have a good track record of very satisfied patients and very happy employers as a result as well. So that helps drive more interest. Next slide, please. So I'll give you a little snapshot about Indus Health. How do we connect great resources and capabilities with people that need it? That's a compelling question, because if you ask most employers, they'll say, well, our employees aren't very well traveled, so would they even use a program that involves going outside the country? And that is the biggest challenge. So at Indus Health, what we have done is focus on building a platform that allows us to coordinate all the tricky pieces as far as an individual patient may be concerned. Everything from figuring out what they need, what they're assessing if it's safe for them to go outside the country for care, and then once they're accepted, dealing with all the details, the travel components and the coordination, doing everything that's required before and after the surgery to make their experience a success, and doing it repeatedly every time. Basically creating a very patient-centric service. That's been our challenge. And we have taken that on, adapted as the needs have evolved, and worked with each of our partners. And Medical Tours is a great example of a partner that knows what they're doing. They have provided a consistent high level of care and hand-holding for patients, and makes this a desirable destination for our patients. Next slide, please. So one of the attributes of our program is just to make it very simple for a company to bolt on. We expect that most HR benefits people are busy and they don't have time to worry through the details. So we take on the responsibility to inform patients of how the program works and engage them at every level, and then make it simple from an administrative standpoint for employers to add on and deal with all the financial components of it as well. And we do it without charging any recurring fees, because we know most employers are sensitive to paying for things that they don't know, how much they'll get utilized. So we've built a model where we can do it without any implementation charges and recurring fees. Next slide, please. So the way our plan works, once an employer bolts it on and makes it available through their benefits and plan design, we then inform members about it and help basically run programs that inform and educate patients how to use it. Potential patients are identified when they have a surgery need. They contact Indus Health. They get a nurse case manager that basically works through all the details of figuring out what their health history is, what their condition is, and if their issue can be addressed well in Costa Rica. And it allows the HR and benefits to be pretty much hands-off that process, and as was referred by Kyle as well. And then we provide simplified billing and reporting that kind of shows how much was spent and what the average was for different procedures. So it's much simpler than the type of reporting that otherwise get provided by the TPAs for local claims. Next, please. This is a busy slide, but it's just showing the different aspects of the touch points between the patients and the ecosystem of providers and caregivers. So we have taken on the responsibility of handling all the administration of the program from an employer standpoint. Also the nurse case management, which involves the medical side of it, the travel coordination that takes care of all the details for people that many of them haven't traveled before, and also the monitoring and compliance to make sure that things are working as advertised. Next slide, please. So the big question is, how much can we save? And typically the savings ranges between 40 to 50% of the costs in the US, and that's kind of net off any incentives and things usually added on to the program. And this provides examples of some of the commonly accessed treatments through our program and what the costs are. And the savings can vary from one region to the next. So we estimate it's usually around, it varies from 20,000 to 100,000, depending on the types of procedure you're looking at. And we help with the claims analysis. We actually work with benefits consultants and help companies estimate what their overall savings can be. Next slide, please. There's a couple of graphs here to just show the utilization and the relative utilization of specialties and the types of procedures covered. So it kind of overlaps with what Brad talked about in terms of the range of procedures. Next slide, please. And this again just shows utilization. It turns out that the majority of our participants are middle-aged, obviously, and the 50 turns out to be both the median and average age that across the board, and also a pretty even split between males and females using our program. Next slide, please. This is kind of a summary of the benefits we provide, again, touching upon excellent medical outcomes, high patient satisfaction, a good amount of cost savings. The overall savings ranges from anywhere from $250,000 to $400,000 per year per 1,000 employees. And that's factoring in, kind of modest utilization levels. And that's usually achieved in the second or third year of the program once people are familiar with it. And there's obviously a reduction of, it's interesting that there's a reduction of time away from work, because with spending time and focusing on recovery, it turns out that patients recover faster by the time they get home. And they usually come back to work quicker. And we have seen employers report shorter disability claims, short-term disability claims as a result. And there's also some secondary benefits. We've seen a reduction of workers' comp claims as well, which is a sort of a side benefit, and also saves the company a lot of money in that regard. And we have been surprised that this program is used probably more by people in rural communities. So many of them don't travel as much, and I think that's again a sign of the fact that they have less options, fewer options, higher costs that they face, and less in savings to cover their costs. Next slide, please. So in terms of generating interest, there are incentives provided. Most employers waive deductibles and copays to the extent they can, unless they're on a high deductible plan, and all the expenses get paid for patients and companions. And there's a cash incentive usually paid based on the level of savings upon completion of each procedure. So we have found that word of mouth is the key driver of interest, and it creates good feedback loop as well for people that either distrust the system when they start out or are not sure about what to expect. And then we also have stories sometimes featured in newsletters and video testimonials that get shared. Next slide, please. So Costa Rica, I think we've touched upon these points. It's just a kind of a wrap-up slide. There's great infrastructure, very friendly people, easy to reach, very well-established tourism hospitality sector, and great medical treatment, and of course, the personalized care and attention. So last but not the least, the handholding provided by medical tours goes a long way in making patients come back ranting and raving about the level of treatment and care and attention they received. So with that, I kind of wrap up this piece. I know I've run over a little bit, but hopefully we'll have some little bit of time left over for Q&A. Thank you.
Ladies and gentlemen, please utilize the Q&A function at the bottom of your screen to submit questions to speakers and panelists. With that said, panelists, we do have some questions in the Q&A function. First question is, will we be able to obtain these presentation slides?
If you allow me, yes, I think that through the California Hispanic Chambers of Commerce, we can make all the presentation information available for all the attendants. So that will be part of the follow-up to this webinar in conjunction with all the contact details where you can reach out our organization in order to explore more about the opportunities that we can, the area where we can work together with Costa Rica's healthcare partner.
Thank you. Next question. How can we assist, and are there opportunities to promote these services?
If you allow me, well, the way that we have been promoting those opportunities, really, we have been seeing during the years a vast array of way of collaborating with different kind of institutions, either individuals. Let me name just one, possibly the more basic one, but really successful. Our dentists, most of all, engaging with their patients in order to work with them and spread the word or speaking about their excellent experience in Costa Rica to their neighbors, friends, colleagues. So they became that became a business opportunity. What we call medical treatment facilitation on an individual base, where we have people, former patients, helping us telling other people. So that there are different ways. I would say we can stay in touch with the chamber as the umbrella of all these organizations, the country efforts in Costa Rica in order to promote those opportunities. So we can stay in touch and see what's the best way to work together.
If you are a U.S. board certified bilingual medical doctor, what is the process of joining your team?
Okay, well, let me try on this. Dr. Yorka, you can. Well, first of all, in order to practice in Costa Rica, you need to be board certified in our country. There are certain rules. Not easy, not immediate. You have to recognize all your titles and go through a process. Speaking Spanish will be a requirement. On the other hand, let me add that during the years, we have been establishing collaboration with U.S. board certified in order to support our program during the process of the follow-up care that we need for our patients being treated in Costa Rica. So there are in this area also different ways of working together. If it is practice in Costa Rica, there is a list of requirements, but also we can work together from the US and establishing a partnership where we can have US board certified doctor as part of our network for follow-up care. Dr. Yorka, I don't know if you want to add something.
Thank you, Massimo. Yes, no, you actually answered the question properly from my point of view. We are also dealing with professional bodies, official professional bodies, and of course you can imagine that you must be registered in the Costa Rican one, and that process is well, it's something we have to deal with if you study abroad, even if you are Costa Rican. It's sort of a board exam process similar to the one we have to face here in the United States, but I'm going to say a little bit easier from my point of view, but that's a personal point of view. Anyway, we have to deal with all of these bureaucratic and well paper thing. process, I'm afraid.
Thank you. Next question. In reference to the doctors available, are there female doctors as well?
Well, yeah, there's definitely quite a few female doctors, and we also work with female doctors, and they're part of the process. But Costa Rica, they're very, very great female doctors as well, for sure.
What is the typical time element from initiation of scheduling a patient procedure to completion?
I'll take that one. Most times the bottleneck is getting the passports. So once we have evaluated the patient, which can take anywhere from 1 week to even 3 or 4 weeks, depending on how ready they are with the records. The next step, once they're accepted and evaluated and accepted, is to get the passport. And that's been a variable, especially during COVID. It kind of extended out to, at one point, to 8 weeks. And now it's back to where it's around 4 weeks to get expedited passports. So I would say on average, people do tend to go within a couple of months of stating an interest. Sometimes they have reasons to schedule it out further out, or in some cases, they're in much of a hurry. And we've had a few patients that already have passports and are able to go much sooner. So we've had patients go as early as 1 to 2 weeks after they've contacted us as well.
Thank you. Can an individual purchase these services, and is there financing for services?
I'll give Brad that one. I mean, Indus Health deals only with employer-sponsored programs, but Costa Rica is able to serve individuals, and Brad can speak to that.
Yeah, we work with self-funded companies, but also with patients that contact us directly, and we're able to schedule things. And we've even had patients come. I recall we were contacted once on a Friday, and the patient arrived on a Monday. So yeah, we're able to do those things. There's obviously a process. The doctor needs to validate and get certain information. As far as financing services, we don't provide any, but I have seen some companies that promote those type of services, but it's not something that we do.
Does the Costa Rica healthcare system accept U.S. insurance? If there is coverage, are there gaps?
Maybe I can speak to that as well. Yeah, we accept insurance all the time, and it just depends on the policy. If there's a deductible or a copay, obviously those things would have to be paid. You'd have to see if for medical travel, sometimes if you have an accident and you're in Costa Rica, just about all the insurance policies will cover that. If you're traveling because you want to have a medical tourism procedure here, you'd probably want to get authorization first if it's not an emergency, but we've had those as well over the years.
And keep in mind, the patient would be responsible for the cost of travel and the hotel, et cetera.
Yeah.
So it's a different model than when it's fully sponsored by the employer.
Yes.
Next question. Can U.S. citizens buy affordable medical insurance in Costa Rica? Can you provide a price range and coverage?
Well, there are, maybe someone else can respond to that, but it depends so much on age, on pre-existing conditions, and many things like that, and what your definition of affordable is. But there are some options that might be interesting.
And last question. What are the major challenges in medical tourism?
Yes.
Rajesh, you can say on your
I take
side.
one of them. I mean, I think if you look at it from an employer's perspective, I think I would say it starts out with just the lack of understanding. In most cases, employers engage with benefits consultants to understand it. And if the consultant doesn't know enough, they're not willing to take it on, or they kind of dissuade them. So we are finding more and more consultants get engaged in the process earlier on, talk to us earlier on, and that creates a different level of outcome because employers warm up to the idea and have the resources to stitch it all together to make it work. So I would say that's the biggest challenge. In many cases, people don't know enough to explain how it should be done well and coordinated and done without taking any chances on having a program that doesn't function really well for you. So some of it has to do with plan design, benefits design. You have to make sure that it does provide enough of an incentive for people to actually use the program as well.
Ladies and gentlemen, thank you for attending the Costa Rica, Your Partner in Healthcare and Destination Abroad webinar. Email follow-up will be sent to all attendees and registrants. On behalf of the California Hispanic Chambers of Commerce, we are thankful for all panelists who've served today. If you should have any additional questions, please contact 916-444-2221. And last but not least, on behalf of the California Hispanic Chambers of Commerce, we respectfully invite you all to attend the Business Policy Summit on March 15th. For more information, please visit www.chcc2022.com. With that said, ladies and gentlemen, have a wonderful afternoon and thank you for joining us.